Hello, everybody. Good evening. Welcome to the live session about the NEET SS revision strategy, the 4-week strategy. I'm Dr. Manish Taneja. We also have Midhun sir with us. Hello, sir. How are you? Good evening.
Good evening, everyone. Good evening, Manish. Just 4 more weeks to go, and this is the high time to step up your preparation. If you have been preparing and waiting for the exam, this is a high time to start your revision. And if you are someone who has been working a lot and thinking about NEET SS, this is the right time to start, at least now. All right.
This is the last stretch,
Go
basically.
off
You have
everything else and start your preparation at least now.
This is the last stretch, basically the last stretch of the race, and you have to be very focused and have be your best. Have to put your best foot forward. You have to pull in your best efforts and everything. So yes, we'll start with the discussion, sir. How to prepare for that? I'll just share the slides.
Yes, Manish.
Okay, so I'll start. Yeah, so we have basically 4 weeks, right? It's on 27th, 28th of December, the NEET SS exam, and it'll be 150 questions. So you have to be very focused in these 4 years. And remember, you don't have time for new things anymore. You have to think of it like Avenger Assemble, kind of an end game, kind of a strategy. This is kind of an end game strategy only. You have to assemble all your Avengers. So your Avengers are things what you have already read. You have your notes with you, whatever you have made in your your PG exams, for your exit exams, or during the preparation of this whole journey from the app, DocTutorials app, from our video lectures, or whatever, wherever you have, if you have read books, right? So wherever you have made those notes from, it's time to assemble those notes. It's time to, assemble all your Avengers and focus on those things, because revision is very important in these days. You don't really have the time for new things, because it's see, I talk about it all the time that it's these entrance exams are maximalist exams. The whole point of entrance exam is to get the maximum number of corrects with minimum errors, so that you can get the best rank possible, right? It's not a 50% pass exam. So you have to put in the maximum effort. You have to get the maximum questions correct. But in the fag end of it, towards the end of it, like right now in the last 4 weeks, you don't really have time to go with the new resources. So stick to what you have already assembled and stick to them very religiously. Okay. You have time to revise, and what already know, so that you feed it in your brain, so you don't get those questions wrong if those questions are coming in the exams. And the best strategy is always to practice MCQs, because you get the feel of the exam, you get what they ask in the exam, and also you get to know your weak areas, so you can work on those and minimize the errors in those areas, because it's a maximalist exam. You have to get the maximum correct questions, and that is the only plan. You can stop here if you don't have time, but I would suggest that you continue, stay on, so that we can discuss some of the important topics which you should be focusing on. Right, sir? Anything else you want to add?
No, absolutely. You're right on the money there. And the most important points from which you will definitely get questions, Dr. Manish will be taking you through that right now.
Yeah. Okay. So before that, so the plan is okay. So I've already said no new topics, no new books. Revise what you already know. MCQs every day, and try to do grand test every week, so that at least you do 3 to 4 grand tests before you appear for the exams. Okay. And focus on the topics every day. Take a chunk of the time and focus on high yield topics. Okay, the topics which are most likely to come in the exam, which have been repeated, although it's a new strategy, but from the past critical care papers and all that, there are few chunks which they ask again and again, and I will discuss some of those few chunks in the coming slides. Okay. So, mechanical ventilation, usually between 15 to 20 questions will be there in the exams from mechanical ventilation. There will be like, they will talk about modes of ventilation. They will talk about the waveforms. They will give you a waveform and they will ask you to interpret it, if whether there is like auto peep happening or some leak is happening or something like that, or there is a dysynchrony or something. They can give you these kind of a question in mechanical ventilation. They can talk about weaning a lot. Okay. They can talk about rapid shallow breathing index, weaning, troubleshooting the alarms. So all of this combined from mechanical ventilation itself can be 15 to 20 questions or even more at times. Okay. Sometimes I've seen even 20, 25 questions also can come from mechanical ventilation, right, sir?
Definitely. That's one of the favorite areas. You have to expect questions from this.
Yeah, and always remember to catch those waveforms interpretation. Okay, so they might give you waveforms, so always have like a ensure that you are very good at catching those waveforms, classic waveforms only, and they will give you textbook waveforms only in the exam, more or less. They won't give you real life waveforms where there might be a problem in interpretation, right? Somebody will say something or somebody might be saying something else. They will give you classic textbook waveforms, and those will be easy to interpret if you have gone through them, 2, 3 times before the exam. Okay. ARDS and sepsis. So these two are also one of the favorites in the examination. With the new global definition, obviously Berlin definition you should be well versed with. But the new global definition you should also know. You should know about the lung protective ventilation, the ARDS net strategy, and everything 6 ml per kg, and all of those things you should be knowing. You should be knowing about when to prone your patient, what kind of peep to use to recruitment, all those things you should be knowing. You should be knowing about driving pressure and all those things, and indication of when to initiate ECMO, Murray score and all those things. So you should be knowing very well about this, and you should be knowing the trials which are very important in ARDS. Okay, so the important trials you should be knowing in ARDS and sepsis, because the trials in sepsis and ARDS are like, of utmost importance and high yield in examination. They keep on asking them over and over again. And same with the sepsis, you should be knowing about, the diagnostic criteria, the SOFA, the QSOFA, and all of those scores. You should be knowing about the bundles approach, the 1 hour bundle. You should be knowing about the vasopressors, lactate clearance, all the trials. So recently, in NISS exam, they had asked about Andromeda shock trial, right? So it is basically from the sepsis and basically about lactate clearance only. So you should be knowing all of these things very well. Okay. They, fluid responsiveness and all. They can ask. They can ask about hemodynamic monitoring. So with sepsis, these things are very important, and at least 5, 10 questions from sepsis and ARDS will be there in the examination out of 150 questions. Sir.
Most of the candidates, I think they will be well versed with sepsis and ARDS. The problem, I think, just like you said, will be with the
I think you broke up
waveforms in
there.
mechanical ventilation. We have a like,
Can you
I'm
repeat? I
sorry.
think you broke up there.
I'm
Yeah,
sorry.
there was a
Okay.
connection maybe.
Waveforms
Yeah.
in mechanical ventilation. Okay. Okay. Let me just turn off my video. Am I audible now?
Yeah, yeah, sir.
Manish,
You're
am I
audible. I'm
audible?
seeing if somebody's commenting about it or not. Yes, sir. You're audible.
Okay. Yeah. We have a lecture on waveforms in mechanical ventilation in our DocTutorials app. I highly recommend that all the candidates should spend some time on that. You will get definitely at least 3 or 4 questions from that topic. All right. ARDS, sepsis, and shock. This is something which we all uh, discuss about during our practice. All right. So let's continue, Manish.
Yeah. And hemodynamic monitoring, okay. So we have talked about PA catheters, arterial lines, CVP, basis of echocardiography, PPV, SPV, all of those dynamic assessment parameters and everything. So, you should be knowing all of those because they are, asked very frequently and talked about very frequently. And there is a lot of interest in critical care with those things. Okay. Now, other important topics, airway and sedation. So, you should know about rapid sequence intubation, all the induction agents, all the drugs we use, ketamine, propofol, etomidate, right? Neuromuscular blocking agents, right? Pre-oxygenation, high flow nasal oxygenation, the pre-oxy trial, this is a so whenever there is a new practice changing thing which comes out, you should be knowing about that because it is like it can be tested, it can be asked in the exam. So you should know about the pre-oxy trial, and you should be knowing about NIVA and HFNC use during rapid sequence intubation and all of that. So yeah, difficult airway algorithm. So all of these things you should be knowing. You should also be knowing about sedation and delirium. ABCD approach, ABCD bundle, right? All of those things which they talk about in the new PADIS guidelines, like avoiding benzo, dexmedetomidine versus propofol versus benzodiazepine, right? All of those things you should be knowing. You should be knowing about RAS score. You should be knowing about, what is the target in the RAS score? What kind of RAS do we prefer in the ICU, right? If we prefer light sedation or deep sedation and all those things, you should be knowing that. And you should be knowing about all the sedative drugs which we use in the ICUs. Okay, and you should be knowing about the side effects of those sedative drugs, like for propofol, PRIS, right? Propofol infusion syndrome and all that. Those things can be tested when your lactates are increasing, and all of those things can be tested. They can give you a clinical scenario where you have to figure out that this is a PRIS is happening and all of those things, right? So focus on that. Focus on things which prevent delirium from the ABCDEF bundle, right? So be very well with that. Some questions will definitely come from delirium and things associated with delirium and PADIS guidelines. Okay. Uh,
Students usually they keep on asking me what all anesthesia topic they should be learning, especially from medicine background and pulmonology background. So these are the overlapping areas between anesthesia and critical care: hemodynamic monitoring, airway management, sedation, and analgesia. These are the only things which you need to learn, which are anesthesia topics overlapping with critical care.
yeah, definitely. Yes, sir. Because I mean, even though they say that they will focus more on critical care during the exam, but I think that they end up focusing more towards medicine and critical care than anesthesia and critical care in the examination. I've observed. But let's see. The pattern is changing. It's a new thing, so things might change in the future. But right now, as of now, what sir is saying is it should be your approach. It's the correct way to go for it. Okay. So also, focus on AKI, renal replacement therapy, all the things associated with it, kidney staging, RRT indication, CRRT versus intermittent hemodialysis, right? Drug dosing in AKI, acid-base interpretation. You should be doing all at least you should be practicing few ABGs daily. At least 5, 7, 10 ABGs in a day you should be practicing, because they can give you ABGs and they can ask you the interpretation as a question, or they can ask you what will you change or what will you do next, kind of a thing in the examination, right? With neurocritical care, they can talk about raise ICP and the guidelines, right? With brain trauma guidelines, brain trauma foundation guidelines, and stepwise strategy. So you should be focusing on that. TBI management, brain death criteria. Brain death is very important. People at least 2 3 questions for sometimes 5 up to 4 questions, 5 questions can come from brain death associated things only, right? So focus on that. All remember to revise it before you go for the exam. And obviously, status epilepticus is one of the favorite topics. So it comes even in the PG as well as in the SS. So you should be well versed with that. You should be well versed with the Norse management as well, right? New onset refractory status epilepticus. So you should be knowing when we are calling it refractory and what kind of medications are we using in refractory status epilepticus. Okay. Toxicology, Midhun sir has covered very well and beautifully in the app if you have gone through the video lectures. So it should be easy for you, but focus on few important toxidromes and few important toxic poisoning as well, like OP poisoning, opioid, paracetamol. These are favorites. Okay, these three at least they keep on and they keep on coming. You know, the antidote, the doses, and all those things. You know, Mac Matthew, all of those things they keep testing over and over again. Okay, even in the previous like previous questions I've seen, so they were there here and there once in a while. So remember to revise that. Sir, anything to add?
Toxicology is one of the most important areas. I think last year itself, we got around 20-25 questions from toxicology. Toxicology as well as trauma, they are extremely important. They will ask only the basic things. Last year, at least, they asked only the basic things, but at least you should cover most of these important toxidromes.
Yeah, same focus on it. And yeah, I forgot to add, last year they asked about Makoka score, right, sir? From difficult airway, they asked about Makoka score. So all remember to revise it. Remember to also do the same score system is also there called Heaven score. Okay, so Heaven criteria is also there for difficult airway. So remember to read it once before you go. And you know, the whole point is that these questions which they can ask, which have been previously asked, should not be wrong. Should not like you should try to get them correct. You know, like at any cost. So revise those PYQs, revise these questions which they have asked in the previous years, and try not to get them correct. And once they show you what direction they are going, they can, you know, adjust their trajectory a little bit, and they will end up going in the same direction. So if they have asked about Makoka, they might ask something similar, which is the Heavens criteria. So be aware of those nearby things, nearby topics also. So because they it gives you sort of a direction where these examiners are thinking in what direction and where they are you know going towards. Okay, shall we move, sir?
Yes, please.
So, bundles are very important in ICU. I've taken, I think, all of those bundles. So, you know, VAP prevention bundle, DVT prophylaxis, you know, nutrition, stress ulcers, you know, your COTI bundle, right? Your CRBSI bundle. So, all of those bundles should be uh, revised before going to the examination. You must be thorough with all the bundles. You must be thorough with what you know, what we do in the ICU, what kind of practice we have in the ICUs. So be very thorough with these things, okay? DVT prophylaxis, nutrition, bundles, all of these things are important and they can be asked in the examination. So I'm talking about pure critical care aspect of it. Obviously, they can delve into medicine aspect of it as well. So they can ask you about diseases, they can ask you about pulmonary embolism, they can ask you about ACS, they can show you an ECG with you know right heart strain, they can show you an ECG with STEMI, they can show you an ECG with LVBB having Scarbosa criteria, so modified Scarbosa criteria, whatever. So they can obviously go into the medicine aspect of it, but here I'm trying to tell you that focus on the critical care aspect of it as well, because we tend to focus on the medicine aspect, but we tend to forget about the critical care aspect. These questions, the critical care questions will be like at least 50% of the paper. Okay. So focus on these as well, along with the medicine aspect of it. Okay. So anything, sir? Know the scoring system as well. Okay. So I have taken the lecture, we have a video about the scoring system, and we have covered most of the important scoring system. But I'm telling you, these some of these scoring system, 5, 6 scoring systems are very important. So know about QSOFA, know about SOFA, know about Apache 2, at least, right? Know about Murray score, know about RSBI, know about GCS, know about Wells criteria. So all of these are important scoring system which you should be very thorough with, and you should be able to recall them in your sleep. Okay, so know these scores by heart. Some scores are very important in critical care, and you should be knowing those scores by heart. Any other suggestion?
Manish, you have compiled most of the
Yeah,
scores,
yeah,
most of the important ones, and
yeah.
we have made it as a separate topic in the DocTutorials app.
Yeah. So
I
go through
recommend
that.
that the students don't trying to, yeah,
Yeah.
don't try to find out all these scores from here and there or Google everything. Manish has spent a lot of time to compile everything together and made a beautiful presentation on that.
Yeah, I mean, most of the important scores I have added. So, like Makoka was missing. So, they asked that. So that keeps happening. They will ask something or the other, which we might not be initially thinking about. But that is okay. That is part and parcel of the game, because, some new questions they will have to come up with every year. So they will come up with those new questions every year. But don't worry about that. So now I've talked about what is important, right? Now, what you should be focusing on. So, the strategy has to be very clear. Focus is revision. And why revision? So that you can catch what mistakes you are making. And how will you know what mistakes you're making? You will know them when you will solve the questions, and you will analyze where you are going wrong. So you will start to figure out what kind of pattern is emerging. You will figure out where your knowledge gaps are, where your weak points are. Okay. So once you figure that out, you will sort of, you can give slightly extra time to fix those knowledge gaps, so that you can get more questions correct from the weak part as well. Focus on your important part. Do not forget, focus on your strong part as well. Do not forget that, because that is where you will get maximum marks. That will give you the best the outcome as well, because you will get most corrects from your strong parts. But focus a little extra on the weak part, so that you can get more correct. And because the rank is decided by the number of corrects, right? So number of marks. So try to get as many correct as possible. So you have to minimize your knowledge gaps. Okay. So how will you do about it? You have to do a lot of MCQs, at least 100 to 150 MCQ a day. You should be your target. Do not go crazy on it. Don't try to do 200, 250 to 300 MCQs, because you will not be able to analyze them. Okay. So be focused, but the focus has to be like, it should not be scatterbrain. Okay. But the focus also has to be very dedicated, so that you can analyze the problems also. If you are doing 400, 300 questions a day, obviously you will not have time to analyze, because you have to spend the equal amount of time in analysis as well. Okay. Do ABG interpretation, all those image-based questions, right? ECG, ABG interpretation, mechanical ventilation waveforms, CVP waveforms, ABG, arterial waveforms, CVP waveforms. All of those important visual questions you should be doing at least 4, 5, 10 every day, so that you can catch them if you see them, and you can save time, because those are visual cues. So once you sort of do them very fast, you will have more time for other analysis based questions. Okay. So that will help you in saving time for your other questions. So visual questions should be, you should be very fast in solving the visual questions. Obviously, don't try to make mistakes while trying to be fast. So ensure that. And obviously you should revise scoring system at least 1 or 2 or 3 every day. And you should do 4, 5 hours of focus revision of your Avengers or your your assembled notes, because those will be your Avengers. So at least like 4 or 5 hours. So this time, what I ideally suggest is, in the last 3 4 weeks, you should spend more time in revising and studying than in your work, if you can afford it. If you can't afford it, try to take some time during the work hours, because app is there, MCQs you can do on the app and everything. Try to take some little chunks of time out during the work, so that you can continue to do MCQ and continue to revise. If you can not afford to you know sit and take some leave days and all that, off days and all that. So I would suggest to be very focused during the last 2 3 weeks, at least, if you can afford to. Ideally, 4 weeks should be minimum, but at least 2 weeks you should target. Uh, Sir, you think any different?
Um, you have covered most of the important areas, Manish.
Okay.
ABG is one area where we need to practice doing questions on a daily basis. So, if you are not that confident, or if you haven't got much exposure in reading ABGs on a daily basis in your during your residency time, listen to Manisha's talk in the DocTutorials lecture. Spend some time on it, but maybe a maximum of 1 day. After that, every day, do at least 5 questions on APG. That's till the exam date, do at least 5 questions on APG. All right. Similarly, other images, ECG is another vast area from which you can get questions, image-based questions. So one of the good resources, Life in the Fast Lane. They just give the ECG the most important management as well as the underlying clinical significance of that ECG. So that's another important resource which you can or you should be referring every day. All right. So remember, ABG every day, one ECG every day. You can cover all the important things by the time your exam is there. All right.
Okay. So, yeah. So, yeah. Now, uh, you will do MCQs every day, but also try to give grand test GTs every week. Okay. So you have 4 weeks. If you can, well and good, give four grand tests in these 4 weeks. If not, at least try to give three grand tests in these last 4 weeks, and analyze what you are doing wrong and stimulate the exam hall. Okay. So be focused, keep your phone aside, keep your distractions away, shut your door, be focused for those 2.5 3 hours, and try to solve those all 150 questions, and be very clear. Try to stimulate the exam hall in those GTs, and then figure out what questions you are getting wrong, so that it will help you better. Okay. Sometimes these GT questions might be even repeated in the examination hall, or at least the same topics will be repeated in the examination. So that will give you some sort of benefit there. Okay. Doing the GTs. Okay. So, and analyze your mistakes. Okay. So analysis is important as much as giving the MCQs or grand tests. Okay. So analysis is as important as giving the tests. But, yeah, and now we have told you a lot about what to do, but what you shouldn't do is, should not be starting and the video lectures now. You should definitely, you don't have the time. Okay, you can't afford, because like I've taken 1.5 2 hours of CRBSI, right? 1.5 2 hours of infective endocarditis. You don't have the kind of time to spend that much time on video lectures now. So do not try to start the video series. Do not try to start reading a book, whichever book you want to go to. Don't start it. Okay. Just focus on your notes. Focus on what you have already assembled. Okay. Focus on it. Do MCQs. Figure out if there are knowledge gaps. If there are really bad knowledge gaps, like you don't know anything, you're getting almost all the questions wrong in that area, then maybe you can refer to the video of that particular topic. or a book for that particular topic, but don't go blindly, scatterbrain. Don't have that scatterbrain approach that you are starting videos now where every video you are trying to finish. That won't work. So only if you really have a knowledge gap in a certain area, then maybe you can spend some time on videos and books for that area, but nothing else. Okay, nothing else. Try to just read your notes if you have those two MCQs, and figure out what those questions, visual questions, which we have talked about: ABG, ECG, vent waveforms, CLP waveforms, arterial line waveforms, and all of those, right? Focus on that. Okay. Now, obviously, don't try to learn ECMO and all that in the last 4 weeks. Don't compare your MCQ counts, and somebody is doing 150 MCQ, I'm doing 100. Don't do all of those things. Okay. Don't waste your time comparing yourself with others. Don't sacrifice sleep, because a rested brain works much better. Recall is much better for a rested brain. I can sometimes, if I'm well rested, I can recall things I've read 2, 3 years ago. So a well rested brain is much, much better for recall than you trying to read two extra topics and getting two correct answers from that. You might be missing more if you are not well rested. At least for the last 3, 4 days, you should be well rested. Okay. You should be well rested in the last 3, 4 days. Okay. And don't panic if somebody says that you have not done this topic, or, oh, they were talking about that topic and I have not read it. Don't worry about it. Don't worry about it now, because what can, like, maybe one question will come from that topic. If you are unlucky, two questions will come from the topic. So don't worry about one or two questions. Try to get those 148 correct. Okay. Don't focus on one or two questions. Okay. So don't worry about it. You haven't learned it by now. It's not important anymore. It's not worth wasting your mental peace on it anymore. Okay. So anything to add?
Um, just like you said, doing the MCQs is very important to find out the gap, your knowledge gap, because many people, especially if you have started preparing only recently, you don't know
Mhm,
where you stand actually. What all things you know, sometimes you might feel that you don't know anything. All right.
mhm.
So that's where doing these MCQs will really help you to find out your knowledge gap, because now you don't have time to go through everything. All right. So one of the areas which you need to focus, especially if you are from a medicine background or pulmonology background, or if you are from anesthesia background, but you don't have an ICU in which you work, is the trauma. Okay. We haven't mentioned that
Yeah,
specifically,
I,
but that from trauma itself, I think in the last paper they asked about at least 10 questions. All right. It's very easy, but the latest ATLS guidelines have been released, and we have made lectures based on the latest ATLS guidelines. So it's there in the app, in the new Critical Care app. All right. You have an old version there, which we released last year, and we have released a new version this year, which is much more concise and much more oriented based on the last year's exam paper. All right. So go through the lectures if you are not practicing trauma on a daily basis. This is something very important. All right. Then some students have asked me about pediatrics. Last year, I think they asked just one or two questions from pediatrics. So I wouldn't advise you to spend uh, any time on it, actually. All right. Just like Manish said, leave those one or two questions, or the questions might be coming the questions might be very simple. I think last year they asked about steeple sign showing an X-ray of a child. All right. The condition associated with steeple sign. All right. It might be that kind of simple questions. And sometimes they may ask some updates from the PALS also, which we have already made a lecture on that. AHA updates. I had done a lecture on that. It's available. So just go through only those things. All right. Then regarding your health, it's something very important. Don't eat too much whenever you get stressed. All right. Because at the end of the exam, even if you don't clear it, you don't want to feel unhealthy. Okay. You don't want that to cause more stress on you. All right. So eat light. It'll make you feel more energetic. It'll help you to sleep, cut down your sleep quota. Okay. Uh, all right. So other than that, nothing else.
Yeah, it is important to focus on your mental and physical health both. Don't try to destroy it for the examination. Anyways, I think, yeah, I mean, I think I forgot about trauma. I mean, trauma is also important because they will definitely ask. Even in INISS, they asked about a crash 2 trial as well. I think, if I remember correctly, crash 2 trial was asked, and so yeah, trials for trauma also, crash 2, crash 3, you should be knowing, right? Crash 1 was steroid, crash 2 and crash 3 are tranexamic acid. Crash 2 is for everything, and crash 3 is for TBI. Okay. So remember those trials, and try to focus on trauma as well. Give some time to the trauma. Yes. And yeah, so for the last week, you should just be revising. No new topics. Just focus on what you have. Try to close the gaps in these 3 weeks, the first 3 weeks, and then in the last week, just revise. Nothing new. No new questions. No new. Not trying to figure out knowledge gaps anymore. Nothing. Just revising, and that's it. Okay. Figure out, so go through all your wrong questions, wrong answers, and yes, be ensure that you don't get them right wrong in the examination. Okay, so figure that out and don't get them wrong in the examination. So analysis is important. Okay, so remember that. The drug doses, normal values, scoring criteria, remember those, revise those. Visual questions, revise those. And for the last 2 days, light revision. Try to give your body some rest. Try to give your brain some rest, because a well rested brain recalls much better than a panicked brain. Okay, and sleep nicely for 7-8 hours, at least. 6 to 8 hours is recommended before the exam. I always sleep like at least 8 hours before the exam. Most, hopefully, I mean, if I get any. So yeah, so yeah, that's about it. And yeah, that is basically the gist of it. Revise what you know, practice MCQs, give grand tests, sleep well, and that's it. And we wish you a very good luck for the upcoming exam. So remember, I just wanted to add one thing. Most of you will get critical care seats because there are enough critical care seat in the country, at least for DRNB. But the aim is to get it in a place which does actual critical care. Okay, so you have to get a good rank. So these strategies will help you enhance your rank. Okay, uh, even if you don't, even if you go and give examination, there is a likelihood that you might get up, most of you might end up getting some seat somewhere, but it will not be worth spending 3 years in, because actual critical care is done in very few places in the country. Okay, so try to get into one of those places, in obviously in the big cities, metro cities, and all that, right? So yeah, that is my own experience. I might be having a different one. Like anything, sir, and
No,
notes.
we have covered everything. Any questions in the chat box?
So nothing. I think there's a question about, can you share PPTs of Surgical Elite series season 4 and 5? I'm not sure. I think somebody from the team will have a look on it. And what about the INISS result? So INISS result, on in the prospectus, they had not mentioned the result declaration date, which they usually do. What I had seen, they had not mentioned the result declaration date, but it usually comes within 2-3 weeks, maximum 4 weeks. Okay, so it should be coming in December, anyways. Mostly by the end November or December, it should be coming in first week or so, first 10 days. So yeah, it should come soon. Uh, Shall we? Ben?
I think we can wind up. If you have any questions, you can personally chat with us
Yeah.
in chat, Dr. Manish or myself, Dr. Midhun. We will be available anytime to answer your questions.
Don't forget, if you are not added in the group, please ensure that you are added in the WhatsApp groups, because Midhun sir is sharing a lot of images in the last days, and it'll help you with the revision. Just have a look at least once a day. Just open the group and check if there is something new in it. So, I mean, ensure that you contact the help and support and get added to the group if you are not added. And yeah, you can contact us on WhatsApp or Instagram. I'm more active on Instagram than sir, but yeah, you can contact us on WhatsApp or Instagram. And yeah, that's about it. A good night and good luck for the exam.
I wish all the candidates all the very best.
Yeah.
Thanks so much,
Bye.
Manish.
Thank you, sir. Good night.
Good night, everyone.